Namaste and welcome to the next lecture of Clinical Ayurved. Myself, Dr. Mayuresh Agte. We have discussed Kamala Pandu as a liver disorders or Rattavasodhas Vyadhi. Now, in today's lecture, I have to give a focus on a very different phenomenon which we come across in our clinical practice. A person comes to you, not patient, and he asks you that, sir, I have a habit of consumption of alcohol of many years, and now I have realized that it is bad for health. I have now stopped consumption of alcohol, but till date which alcohol I have consumed must have some bad effects on my liver. So please give me the medicines for that problem. Now see, he doesn't have any lakshana at present, like Lagnimandya, Amodpatti, Pandu, Kamala, no symptoms present. If you find many times the reports of the that such persons, for example liver function test or sonography, also appear normal. So when he is asking you this about this problem, he doesn't have any symptom, no symptom, so no particular vyadhi and no particular samprati, but he is expecting from you that you should give some liver tonic so he can be satisfied physically as well as mentally also, that whatever bad effects of the alcohol on the liver now are the medicines are taking care of. Now in such patients, how will you deal? Because there is no specific vyadhi, so samprati and specific treatment are all apart, but we have to treat that person. Now you will say it's very easy, give liver tonic, so give Arogya Urdhani, Suchshekar, whatever you want. And I also agree there is nothing wrong. It appears very easy logically. Give some liver tonic, ask him to give a take for many months so that the liver will be taken care of. My point of discussion is, can we analyze such patients samprapti even there is no disease, no symptoms? Let us discuss this point. So, why it is important to analyze such patients samprapti? Because you can come to the specific line of treatment after such evaluation. Hence, what I am saying, giving any liver tonic, Argari Suchakar is nothing wrong, but we are discussing the particular treatment can we give in such cases. Let us start the discussion. Patient is asking about the liver problem because of consumption of alcohol. Now, Hetu is Madhyapan and target organ is liver. So, can we can we evaluate this patient as Madhya is the only Hetu in the category of Madatya? Though symptoms of Madatya are different, I know, or even if you can't nominate in this patient in any disease, or you can't frame this patient in any disease, let us fix with the Madhya as a Hetu only. So, Madhya is the Hetu and liver is the target organ you have to think of. Now, in such cases, you have to keep in mind a good reference in the text in the Nidan Panchak, which is Viparita Upashay. What it means? Give the same treatment which is equivalent to Hetu. And in that case, they have specifically used given two examples, Vishavar Vish and anti-Vish, and Madhya and anti-Madhya or antidote as a Madhya only. What it means? If there is a Vishalakshana in the patient, use another Vish in the treatment which will have opposite properties. And similarly, they have given another example of Madhya, that if in the case of Madatte, in the treatment you should use Madhya only for Madatte Chikitsa, but it should be have altogether opposite properties than the Madhya which is acted as a Hetu. So, in this case, when a patient comes to you as Madhya as a Hetu, you should think in the mind that Madhya, and for Madhya in Chikitsa also Madhya Kalpana, it means Asava Arishta Kalpana should be the best choice of the treatment. So this will be your first analysis of the in the Chikitsa according to the Hetu in the patients. So taking reference of Viparitarthakari Upashay, remember in the case of Madhya, use another Madhya having different properties in the treatment. So, first line of treatment will be you should use Asava Arishta Kalpana because it is the naturally generated alcohol in our Vaishya Kalpana. Okay, first things. And now target is the liver organ. So use the asava or arishta containing the dravya which have gamitva on the liver. Use asava or arishta kalpana having dravya made up of which these made up of specific dravya which have gamitva on the liver. For example, Kumari Asav. Kumari is a very good liver tonic, you know. You can use Bhunimbadi Kwath, which is a liver tonic, and Kwath Kalpana, which is also you can get in the market as a Asava Arishta. Amruta Arishta, Guruchi is again liver tonic, and it's Asava Arishta Kalpana, which will act on liver fast and which will take care of the bad effects of the Madhya if happen, if any. So you can analyze such patients samprapti, though there is no symptoms, there is no particular Vyadhi as such, but according to Hetu, you should be able to analyze such patients in your paribhasha and give the specific treatment. It does not mean if you give Argadini, Suchakar is wrong. No, don't misunderstand. You can give any liver tonic in the form of churna, in the form of tablet, nothing wrong in that. But considering Hetu, you can reach to the specific target oriented chikitsa for the fast and better results. Hence, you can use the dravya which are acting on the liver in the form of Asavarishta or Arishta will be the better choice when the Hetu Madhya is the specific Hetu in your patient. In my practice, I always use this as a, so I will use Kumari Aso, I will use Amrutarishta, I will use Bhunimadikvar, and there are so many Asavarishta which are available in the market and having action on the liver. So, in spite of using churna or tablet, which is not wrong again, I will give preference to the Asavarishta Kalpana based on the evaluation of the patient's history and evaluation of the Hetu in that particular Hetu in that patient. Hope you have understand and like this thought. I will appreciate your comments on this subject. Thank you very much.